Medic-to-Medic is a healthcare application designed to bridge the divide between primary and secondary care and exploit the connectivity of intranets and internets to facilitate medics sharing clinical practice in a manner not possible in the era preceding the World Wide Web. The map of medicine is the central module in this application. For each symptom, a clinical pathway has been developed which guides the healthcare professional through the process of best practice. This short video demonstrates some of the methods used to develop each patient journey. This Graffitti methodology allows the rapid development of best practice pathways. The Graffitti Sessions are arranged in an open space, in this case the Education Centre of the Royal Free. Specialist departments are then invited to participate in a half-day educational event which we term the Graffitti Session. Well in advance of the event, the consultants, specialist registrars, nurse specialists and a group of general practitioners are allocated a topic and are sent background material to prepare for the session.
Yes.
Yes, so if we
That
had...
goes straight back there.
On the day of the event, each team gathers around a table and the pathway development is moderated by a highly prepared senior specialist registrar or a consultant. Each member of the group can participate in the discussion, which generates the Graffitti-style pathway sketches. The informal style of the meeting encourages participation, and a large supply of paper and colored pens allows the pathways to gradually emerge. Once the pathways and its backing text has been completed, the pathways are pinned onto a board in poster style, and a spokesperson for each group presents their pathway to all the other participants. Once peer-reviewed in this manner, the paper version is redrawn using a combination of Word and the PowerPoint organizational chart. These are then printed out and sent to the team leader for final review. In this way, a number of peer-reviewed best practice pathways can be rapidly developed and drafted into final pathways, which are then integrated into the medic-to-medic application. In discourse mode, a multidisciplinary group is asked to prepare in similar fashion to the Graffitti session, but discourse is used to ensure that everyone in the group is given the opportunity to participate anonymously using an iPack linked by Wi-Fi to a workstation. An expert witness facilitates the session by asking "What next?" questions. The input of each participant is captured on a workstation, and the facilitator can extract the consensus view and use this as the basis for developing the pathway on an electronic whiteboard, again using a Graffitti development style. The whiteboard output is then saved and again transformed into PowerPoint format and then entered into the medic-to-medic system. The third method we've used to develop patient journeys has developed around the concept of mind mapping. This is usually employed when a single specialist develops a journey. Using software called Mind Manager, the expert develops a spidergram of all the information, and this is used as the basis for constructing the pathway in an organizational chart prior to integration into medic-to-medic. Using these enterprising and highly educational methodologies, the medic-to-medic team has, together with a number of doctors, developed about 200 pathways which form the core of the map of medicine component of the full medic-to-medic application.